Today, I would love to share with you who Bupa is, because I believe that in the UK, there is an understanding of who Bupa is, but Bupa has been changing rapidly in the last few years. And that change of Bupa put us into the context of on how we're embracing digital and the role of digital for the Bupa we want to become for the future and the impact we want to have with our customers, but also with society. So for that brief introduction to Bupa, 3 key aspects, and then we will move into a journey to understand how we are using digital to really embed and embrace the new customer needs, because something is clear that healthcare is being disrupted by consumerization, okay? And by that, I mean people are expecting information, services, and care on demand, anytime, any channel, anywhere, all right? So, and through that journey, we will also see some other key aspects of disruption for the healthcare ecosystem, okay? So, without further ado, which is a sentence I love using from the English, okay? I'm Spanish, so I'm trying to steal idioms as fast as I can, although sometimes I get them wrong. So I would like to start saying that Bupa is a global health and care company, obviously created in the UK in 1947, so slightly before the NHS, and we believe it is a UK success story. Why? Because now we are operating all over the world. We have very strong operations in 12 countries, from Chile to New Zealand. And as you know, health insurance is at the core of our business. However, it's not just what we do. We also run clinics, hospitals, dental centers, optical centers, wellness centers, and we are one of the largest operators internationally about services for the elderly through care homes and retirement villages, and also through home healthcare. So we employ 80,000 people that look after the health of 29 million people globally, okay? So I guess that gives us a picture on the footprint of Bupa and the nature of what we do. So this second slide is, to us, the most important for everybody who works at Bupa. We are a purpose-led company, okay, and we are driven by longer, healthier, happier lives. That's the outcome we want to generate, all right? And I must say that Bupa, we are a private company, we are for profit, but we don't have shareholders. That makes us quite a special, unique player in the healthcare ecosystem. So we believe that profit is the fuel in the tank to fulfill our purpose, longer, healthier, happier lives. And so that's why we can reinvest that profit into providing better services for our customers and to enable driving those services to more people all around the world. And also, it helps us make decisions for the long run, strategic decisions for the future of better healthcare systems, which are driven by making quality healthcare affordable and accessible, products and services that are personalized to the individual needs, and also driving innovation and partnerships to tackle the toughest challenges in healthcare, where non-communicable diseases or long-term conditions are at the core of the global issues around healthcare. So now you're starting to get where digital starts coming into play with this picture, all right? So, and we have a 2020 vision by which we say that we want to improve the health of the world and being loved by customers. Digital is at the core of this ambition. So, our business model is predicated on 3 pillars, okay, and we call it integrated care. So, we focus on engaging individuals in their health and well-being for prevention and also for better managing chronic diseases like diabetes, cardiovascular, cancer. And then also we are focused on funding. This is the health insurance model, which is around 70% of our business model. But there are other models like we have in Poland, like through subscriptions, and we will love using digital to explore new business models for funding access to healthcare. And as I mentioned before, the third area of Bupa is we are healthcare providers. And there are not many companies around the world that make that combination of health insurance and healthcare provision. And for us, that's a driver of providing better quality of outcome because you can control the quality of the services you provide through your own network of doctors, but also because it helps you understand the economics of the whole system in a much better way. So, coming now into the digital opportunity, we believe that digital play a key role in reshaping, in helping us creating new models for the 3 pillars of our business, and in summary, to drive better integrated care business models. So, and digital also, we are understanding that is a source for us to drive new partnerships that with partners that we are not used to play with, like telco operators, for example, like international institutions like the World Health Organization or the International Telecommunications Union from the United Nations. So, and more importantly, digital is a driver of a new culture within the company. So, but I must admit, this is not a story of success. I would like to present this as a story of rapid lessons learned. We want to become a digital business. We are not quite there yet. We have the executive support, the mindset, and now we are making it into action. And the journey we're going to see today, it's about things that are currently happening, okay? But hopefully I can convey the messages about the forward-looking impact of this journey we're going to see. So, and in a nutshell, I would like to say that also for us, digital, okay, enables the healthcare improvement of the healthcare system, but more importantly, getting closer to the needs of the people we help having a healthier life. So, and basically 4 pillars. Digital help us educate and empower individuals, help us improve access to quality services and to the provisions, to the providers, help us better coordinate care, and more importantly, driving more affordable and more efficient means of delivering healthcare. And data, it's playing a key role across those 4 pillars. So, let's start the journey. We think that all of us, we have needs for better information. So the very basic, simple thing that we provide is a wide array of health information sections about conditions, about prevention, and also interactive assessment tools. We've been doing that now for over a decade, and we're learning how to do it more efficiently, more effectively, and we can claim that over 130 million people engaged with us last year through these very basic, simple information channels, but we believe are truly relevant for the moment that the individual is looking for information. And looking for health information is one of the top searches that are happening when people go to Google. But if we move, and we have that offering all across the world, all right, the Bupa world. So if we move now into more advanced proposition, apps. Okay, everybody's doing apps, and internally we have the challenge on how we put order into that plethora of app interventions, app engagement that are focusing in engaging people in their health and well-being. I just brought 3 examples here. So the first one is Bupa Boost, which is aimed for engaging employees for our corporate client, okay? And because we understood that our corporate clients, they have the need of engaging their whole, workforce. However, in some cases, not all of them are insured. So Bupa has created a solution for helping employers to keep the whole workforce engaged in health and well-being with some components of gamification, of social nudges, social networking, and helping them to get better advice in physical activity, nutrition, relaxation, and also mindfulness. And that's quite an amazing area in which digital is helping moving, opening up the conversation about keeping people healthy is also keeping people's mind healthy. The second one, Food Switch, was created in partnership with the George Institute, which is an academic institution a global one, but in this case based in Australia. And we co-created Food Switch, which aims or helps individuals scan the barcode of any product, any food product, and then retrieving through a database the nutritional value of that food. And the app, through an algorithm, finds the alternative, healthier choices to that product. And this has been now filtered. You can filter that service for fat, calories, and also sugar and salt, which, depending if you are having hypertension, diabetes, could be relevant to you. And the third one, Brighton, we're piloting it in early next year. But I think coming back to the point of mental well-being, stress is a key issue for employers, but for individuals, and we believe we need to tackle it differently. So we're helping people building mental and physical resilience to stress. And in this case, the app, in the future, through new wearables like the Microsoft Band, we will be capturing individuals' heart rate variability, also through sensors that can capture your values from your skin and from your body temperature. We can understand the quality of the stress, if it's toxic, if it's a good stress. So basically, I think we have 3 starting points. We have many other apps, but I wanted to bring these 3 to let you know that we are working on the space of prevention through apps that, with all the new devices and the new platform, or all the platforms about fitness, all that data can get played into those interventions to become smarter, more relevant, and more tailor-made to the individual's needs. The next example is, okay, we've been searching for information, we've been engaging with apps, but now I need a doctor. So we believe that the Facilities Finder in the UK, it's in our UK business, is a great example of using digital to unlock data. Okay, health insurance and many companies from many industries, you try to get your data within the walls. What we're learning is that by opening the data now, we have one of the most comprehensive directories, public directories of physicians in the UK, and we're adding additional value to the user, okay, that we can bring the relevant physicians based on location, based on if the fees are assured, okay, because some of our customers complain that when they go to a private GP, then the fees are higher than they were expecting. So we are now bringing transparency into that, and we're enabling also the doctors to enrich their profiles, and we validate that information. So we're bringing together company-driven information, patient-driven or individual-driven information, and doctor-driven information. So we believe that that is helping us to let people accessing to our services in a more transparent manner. So once you identify your doctor, you can do the online appointment booking, okay? And this is coming from our business in Spain, where over 700,000 people have booked their appointment through online. What does it mean? It is we are opening our processes to the convenience of the user, not to when we are able to offer those appointment booking services through the phone or through offices in opening times. So, and we're learning a lot about how also integrating third-party integration, third-party provision, medical provision integration into the agenda is helping us grow to meet that consumer demand more rapidly. So, and then once you get your appointment booked, okay, in this case, we are also moving into providing remote video consultation. This is very, very new. We've launched 2 services, one in the UK and one in Spain, different models. In the UK, we are partnering with Babylon Health, an amazingly innovative company, that we are offering the service again for our corporate customers at the beginning to really understand how it works and the demand from the users. But now if you need to see a GP, you don't need to get into a taxi or into the tube to get to the consultation and go back to work. You can get your GP consultation real time and with a set of information around it. And it's part of your corporate cover. And if somebody is not covered, can access to that service through a discounted rate. And in the case of Spain, it's a different model. We've understood that people are asking for more innovative, digitally driven insurance products, and we've packaged it as a new, very focused, digital interaction-driven product. So you can do almost everything digital when you buy that, and even you get like a latest generation smartphone device to access to that service as part of the package. And it's, I think, below 100 euros a month, all right? So, and with unlimited consultations. So then, once you go through to the video consultation, in Spain, in Sanitas, we also offer the personal health record. And again, the transformational aspect of this, it is moving towards the giving ownership and empowerment to the individuals about their medical data. This is accessible through the members portal, and they can see the reports that have been uploaded by their physicians, but they can also bring all the reports and uploading them into the platform, and they can access their medical reports, lab test reports, and also diagnostic images. And they can share with the relevant doctor if it's Bupa 1 or not a Bupa 1. So we can see that this is an amazing area for driving further empowerment of the individual in getting educated and helping them to make better decisions when it comes down to the healthcare. So then if I'm suffering a long-term condition, all right, Bupa is also enabling remote monitoring. This is the case from Chile, our company there, Bupa Chile. And this is just a pilot in which we are providing individuals suffering diabetes and hypertension like a technology toolkit, okay, that enables them to be 24/7 connected to a remote call center. And it's just data that moves from the devices to the call center. And the call center, they see the trend, they see the data, and if there is any red flagging or amber flagging, then they get directly in contact with the individual. This is sort of the basics. We've understanding that after 1 year in the pilot, 80% of the people stay in the program, which is a really good rate of retention. It means that we're adding value. But more importantly, we are also understanding that those people who stay in the program are driving a reduction in the cost of hospitalizations, because for diabetes, hypertension, both comorbidities can drive high risk of complications and hence hospitalization. So for us then, as you can see, we are avoiding people getting into acute episodes, but also we are driving increased cost efficiency within the business. Satisfaction, cost efficiency. We believe that's the holy grail of digital, including with reach, okay? So, and in that, management of long-term conditions, shared decision-making is crucial, all right? And together with prevention that we've seen before, and we are exploring introducing wearables, the data coming from wearables to enrich this picture, and we've been also collaborating with IBM Watson in order to start exploring artificial intelligence, machine learning, into driving more relevant information based on the individual's needs. So, and finally, we also are truly believers of the role of digital in improving better coordination of care. And we've been in a journey in our care homes business in Spain by which the internal management solution that was used by the doctor, like a typical that you need to go to your office and then you need to type all of the information about a patient, about the program of care. Now we've empowered individuals in the last year and a half to get to a tablet. They get a tablet, anybody, so doctors, specialists, nurses, and other professionals in the care homes, for them to be permanently inputting data about a resident and permanently accessing to any information around 70 indicators of that individual. What we're learning from that is that our carers are spending more time with the patient, with the resident, and not processing the information. So the care at point of care is becoming better, and through that, through understanding real-time medication, diet, position when they are in bed, faults, we are learning how to improve the service to those residents and to their families in a much better, efficient way. And now the next step is moving that internal data to mobility and now moving it into visibility for the relatives to see in remote some key data regarding their loved ones who are in the residence. So this is what, if you can see, is sort of a journey through the core customer needs and how we're embracing digital to better meet those needs. But as mentioned, we're truly driven by our purpose, and we want to better serve our customers, but also beyond that. So we've been shaping, and health has been helping us to shape new partnerships in this space. So I'm very proud of saying I've been leading the partnership between Bupa and World Health Organization and ITU to help governments embed mobile health solutions to tackle non-communicable diseases, diabetes, hypertension, cardiovascular diseases, and cancer. So as you can see, we are truly excited of supporting that global program, but also in opening collaborations with governments such as Mexico, and we know that Mexico is the developing country with the highest prevalence of obesity and diabetes. We feel very proud that they would love to work with Bupa and reuse some of the assets we've been seeing through today into make it relevant to the Mexican population, and together with other partners and together with the key actors within the public health system there. In the UK, we are collaborating with Public Health England because they are leading the mobile hypertension stream of work within Be Healthy, Be Mobile, and we're truly excited of collaborating on a human-centered research about blood pressure and hypertension. The problem with non-communicable diseases is that they are invisible, and when they are visible, it's because of symptoms and it's too late. So we have the mindset of how we can move of blood pressure from becoming a health threat when it's too late to becoming an aspiration, something that you want to look after very well and keep it in good shape. And I guess all the conversations around fitness and well-being is already helping us putting people in that mindset. So we need to leverage those behaviors. So, and that's a source of innovation. Innovation is not just about flogging technology, okay, or flogging more devices into the common channels. We believe that to drive innovation, you also need to deeply understand people's beliefs, people's knowledge, and people's behaviors at the core of healthcare and their attitudes. And once you understand that, then you talk about channels, you talk about technology, and you talk about specific solutions. And also, we're very proud of starting having conversations with the governments of Costa Rica and the Philippines to reuse our Bupa Quit app, which is an app that we've developed together with University College London. So we took their app called Smoke Free 28 into the next level. And it's pretty simple but very clever. And we're very proud of this development in partnership with UCL. Because in the end, what it aims, as many other programs, aims for helping you not smoking for at least 28 days, which is the cycle for you to start changing your behavior. The beauty of the app is that it's predicated on the principle of distraction. So when you have a craving, the cognitive behavioral therapy tells you that drive a distraction for 3 minutes and that craving may disappear. So through the app, what we are helping people is becoming aware of the craving, scoring it, and then choosing one of the different behavioral change techniques for that, like remember the goal while you are thinking on smoking, and it's because I want to be better at, for example, or access to content, or access to testimonials from other people. And at the end of that intervention, or access a gaming, the individual can rate the effectiveness of that distraction technique. And imagine the amount of data and relevant data that we are gathering to understand what works for which individual, for which craving, at which time of the day, which intensity. So when we come to data, we love to understand that big data could be massive, great, dangerous. It could be also very small, very relevant, very timely. And this is what we're working on. I'm conscious of time as well. So the other aspect of and entering now more into a more ecosystem perspective, We believe that if we are truly serious about driving affordability of quality healthcare, we need to understand the needs of the middle and the bottom of the pyramid, where billions of people in the world, they don't have access to these services. So we're exploring partnerships with telco operators in the different parts of the world and trying to shape new business models. Telco operators, they have an issue in terms of driving loyalty, reducing the churn of their customer base. They are starting to offer packages of life, accident and health insurance as a way of retaining those customers. So we've been collaborating with Airtel Bharti and other partners in Ghana and providing the underwriting to offer hospitalization cash for people that they don't need to pay for it. The telco operator is paying for that. And we believe that's an amazing opportunity to provide access to healthcare. If somebody now needs to be hospitalized and they have this cash hospitalization, they get an indemnization that hopefully avoids their family to disrupt the family economy, or that children can still go to school and not start working. So, but we believe that's a great opportunity where we are just starting. We would love to learn how to build further propositions in that. And if we think more about the ecosystem, Bupa has been partnering, two examples of many, but Bupa has been partnering with the magazine Wired. They do this vertical event, Wired Health, where they bring all of the future healthcare disruptors into London. And in there, last year winning, we ran the Bupa Startup competition in there. We believe it's a great way of bringing the outside in. And the winning company last year was a company called Neuroelectrics, based in both Barcelona and Boston. And they created a soft helmet that is connected to the internet by Wi-Fi. And they can remotely monitor and stimulate your brain, the electric activity in your brain. And that's quite cool from the perspective of, and quite effective from the perspective of helping people recover movement after an acute heart episode or an accident. There are some part of the areas of the brain that needs to be stimulated, and that can be done now from one place to any part of the world. And they are using this technology with the Red Bull Extreme Sport team, which tells you that it's also driven to extreme performance. And finally, also another area where we are actively playing is Health Excel, which is a consortium for innovation, where companies such as Icon, IBM, Linde Healthcare, Cleveland Clinic are part of it. And we believe that because of the complexity of the healthcare ecosystem, this is sort of mini replication of it, a network for collaboration where we can, with opportunities and challenge, in order to collaborate together differently, okay? And in that network, we have access to over 800 startups, and we have in permanent discussion with them, because these are the guys that are doing the technology and the services that will be the base of the future healthcare. And finally, conclusion, so absolutely, as I said at the beginning, digital is driving the consumerization of healthcare. Companies, we have the accountability of being closer to the individual's needs, and hence we need to change whatever is required to meet those needs in a tailor-made manner, relevant manner. We are not a digital business yet, but we are learning a lot. I always say that digital disruption, you can see it as the wave of a tsunami, or the highest and largest wave ever to ride. So could be fear, could be exciting, and quite optimistic, okay, but you need to get your acts together. And we believe digital will make our business model stronger and will help us accelerate innovation. Partnerships at the core of everything we do. Disrupting healthcare is not something that not a government, not a private company, not an academic institution can solve on their own. It requires cross-sectoral participation and collaboration. And if we remember our purpose, longer, healthier, happier lives, and our ambitions of improving the health of the world and being loved by customers, you cannot do it without digital. So thank you very much. I'm open to any questions you may have.